welcome you all for this webinar. So women's health is a very important topic. Most of us might be listening here for our loved ones, like our mothers, our life partner, our daughters, our sisters. And some of us will be hearing it for our own selves. So let's start anything and everything about women's health in this webinar. Next slide, please. So women's health includes disorders of the reproductive system. And in this webinar, we will in detail discuss all the following disorders. Next slide, please. So women's health is a very broad topic. It includes adolescent health, reproductive age group health, postmenopausal health, and at every step, it combines mental, emotional, and spiritual health as well. So whenever we are talking about women's health, it doesn't mean health of her reproductive organs. This is a very broad category which involves adolescent, reproductive, and postmenopausal women as well. Next slide, please. So women's health is a combination of physical, mental, and emotional health at every stage of a woman's life. Next slide. So the first step about women's health is right to education. So most of us do not talk about menstrual health. We don't talk about infertility. We don't talk about problems of our reproductive organs. We don't talk about mental and spiritual well-being of us. So the first step is education about the issues related at the point of time when they are expected to come. Like for example, an adolescent girl has the right of education about her menstrual cycle. Most of the girls hear bits and pieces about menstrual cycle, about periods in their school, but there is no formal education that is given to the girl about menstrual hygiene, about periods, how often they should occur, what should we do when you miss your periods. So there is no education about menstrual cycle. An adult married lady should understand about fertility related issues. She should understand when is the right time to conceive in case she is delaying her pregnancy, what are the options available to her, and what should she do if she feels that she is too late to finally start her family. A lady approaching menopause is the time when we women stop having our periods, should have the right of education about the hormonal well-being and bone health of one's own, because loss of bone health can lead to fractures because of low calcium and weak bones. Next slide, please. So if we talk about gynecological disorders, it is very important to understand what does reproductive organs in a girl include. So all we women were blessed with one uterus, which is a very muscular organ. It is the site where our baby comes when we are pregnant. On the side of the uterus are two thin, tiny fallopian tubes. Now, these tubes are less than 2 millimeter in internal diameter. So they are very thin structures located along the side of the uterus. And the fallopian tube form an area where egg and sperm meets to start a pregnancy. Below the fallopian tubes are two egg baskets or ovaries or andedani that we call in Hindi. And they are storehouse of the reserve of eggs we were gifted when we were born. And the uterus opens into the vagina. Vagina is the area where intercourse takes place. Next slide, please. Now, very importantly, whenever we talk about reproductive health or menstrual health, it is very important to understand when does ovulation happens? Is it same for all of us? And in case it is different, how do we track ovulation? So what does the term ovulation mean? To understand this, we should understand that we women were blessed with a fixed number of eggs, and these eggs were given to us when we were born. This is like our small FD with which we came to this planet. And as we age, the eggs in the pool that we have are continuously declining, and they will one day decline to the level when they will be left nothing in our ovaries, and that is the time when we attain our menopause. Now, every egg is enclosed in a water bubble, and this bubble is called a follicle. Now, whenever we do an ultrasound of a girl or a lady, we do not see eggs because eggs are microscopic structures. What we can see is the water bubble in which the egg is entrapped. Now, if a girl has 28-day cycle, roughly on 14th, 15th day of her menstrual cycle, this water bubble enclosing a mature egg inside bursts and releases the egg outside. So this process is called ovulation. Now, after ovulation happens, the tubes, which are wavy structures with fimbria or a wicket keeper like ends, grabs that egg and take that egg inside the tube. Now, in the tube is the place where the egg meets the sperm. So this area is called fertile period of the lady. Now, हमें हमेशा ये लगता है कि every woman ovulates roughly around 14 days, but unfortunately that's not true. Now, if a girl has 35-day cycle, ovulation would happen roughly 14 days prior to her expected cycles. So if I have 35-day cycle, my ovulation should occur on day 21. If I have 40-day cycle, my ovulation should occur on day 26. So accordingly, my fertile window is also changing. Fertile window is the time when the egg is released in a woman's body. So when ovulation occurs, that's the time when it is fertile window, and that is roughly 14 days prior to the expected period. Now, it is important to highlight the time of ovulation because the life of the egg after being released from the follicle is only and only 24 hours. In these 24 hours, it is important that this egg meets the sperm for it to conceive a pregnancy. So again, I'm highlighting that ovulation occurs on 14th day of a woman's period, and this is the time when the lady is in her fertile days, and this is known as most fertile days of the woman's cycle. Now, let's understand certain common problems which a girl or a young woman faces while having her periods. So the first topic of discussion is a very, very common problem. I'm sure every woman sitting out there can relate to this, which is called painful periods or dysmenorrhea. Next slide, please. Next slide. So dysmenorrhea means painful periods, and it is menstrual cramps that occurs at the time of periods. So this occurs due to continuous contraction and relaxation of the muscle of the uterus. Now, dysmenorrhea can be primary or secondary. When primary dysmenorrhea is when we cannot identify any cause behind this painful period, and this is probably due to release of excessive chemicals called prostaglandins, which cause spasm in the uterine walls and vasculature. The second variety is called secondary, which is generally due to certain pelvic pathology like a polyp, endometriosis, fibroid, and in some women, dysmenorrhea or painful period is also associated with nausea, vomiting, diarrhea, dizziness. Next slide, please. Okay. So whenever a girl comes to us with dysmenorrhea, it is very, very important to do a pelvic ultrasound. In case she is married, we do a transvaginal scan to identify if there is any underlying pelvic pathology. So what do we do if a girl faces dysmenorrhea? So the foremost change that is required is known as lifestyle changes. In case you have a very hectic lifestyle, you're not sleeping properly, then believe me, if you follow a definitive routine in lifestyle, you follow a definitive pattern, a sleeping pattern, then most of the cases of dysmenorrhea will not last for long. It is important to stop smoking and have a balanced diet. In case you have too much of dysmenorrhea, try using a heating pad or a warm bath. Any relaxation technique like yoga can help. Use of certain painkillers like NSAIDs, paracetamol, antispasmodics can also help. Sometimes the doctor prescribes contraceptive pills so that the bleeding is less, the contractions are less, and the pain automatically is less. And very rarely, we insert a hormonal copper T inside the uterus to prevent pain. Next slide, please. Now, another very common problem which we routinely encounter in any female clinic is called amenorrhea. Amenorrhea is a very simple term that defines absence or no periods at all. Now, whenever there is a woman who comes to the clinic with amenorrhea, the first test we do is to rule out pregnancy, because that's the most common reason of not getting your periods. Now, if a girl who is 16 years and above with no periods at all, never ever needs evaluation, it's very important to visit an endocrinologist and a gynecologist to understand whether there are any underlying problems which has not led of start of menstruation. Now, whenever we see a lady or a young girl with amenorrhea or no periods, we focus on history like excessive weight gain or vigorous exercise. All of us will be surprised to know a fact that vigorous exercise or too much weight gain can also lead to amenorrhea. So yes, doing exercise, leading a healthy lifestyle is very important, but anything beyond the normal rule can lead to problems like amenorrhea. Sometimes we try to do certain blood tests like doing a thyroid evaluation, doing prolactin, few hormones like FSH, LH, testosterone. Sometimes a karyotyping is done, an ultrasound is done, and finally we understand the cause behind amenorrhea, and accordingly we try to manage the situation. Next slide, please. Now, abnormal uterine bleeding. So generally, we see that we follow a regular pattern in our periods, in our menstrual cycle. Any deviation from the routine is called abnormal uterine bleeding. Now, it might be heavy period, it might be very little or scanty period. The average frequency of periods is 28 days. Anything below 24 is known as more frequent periods. Anything above 38 is known as infrequent periods. Now, normally a woman bleeds for 5 days. If she bleeds for more than 8 days, then it can be prolonged periods. If she bleeds for less than 4.5 days, it can be shortened cycle. So what do we do? So I'm sure most of us, one point of time, has faced certain issues in our menstrual cycle. So whenever we feel that we are facing some issues in the regular menstrual cycle, it is very important to visit a gynecologist. Next slide, please. So generally, whenever we see abnormal cycles in a lady, what we first rule out is, anemia, because very low levels of hemoglobin can also lead to scanty periods. Then we do an ultrasound to understand that there is no polyp or a fibroid sitting inside the uterus. And accordingly, we guide what should be the management protocol. Now, PCOD or PCOS. So, I think most of us fear this disorder. And most of us feel that somehow we have to cure this problem. So, let's understand what's this. It is a very, very common problem. Almost 20 out of 100 women suffer from polycystic ovaries. Now, when polycystic ovaries is associated with irregular periods and signs of excess of male hormones in terms of facial hair, acne, growth of hair at places where they are not supposed to grow, like chest, thighs, legs, then such a condition is known as polycystic ovaries. Now, polycystic ovaries is a genetic problem. When we do an ultrasound on such a girl, her ovaries seems occupied by too many eggs and follicles. So there is no cyst per se. Actually, PCOS or polycystic ovaries is a misnomer. There is no cyst in our ovaries. But whenever we do a scan for such a lady, we find too many follicles, too many eggs in both the ovaries. Now, whenever there is excess weight gain, the amount of male hormone in that girl increases, which can lead to abnormal periods, which can lead to acne, facial hair, and signs of excess of male hormone. Next slide, please. Okay, so the second picture shows how polycystic ovaries looks on ultrasound. So if you can appreciate the black bubbles seen in the scan, these are called follicles, and at one point of time we are able to see more than 12 follicles. Next slide, please. Okay, so most important, how do we manage polycystic ovaries? So friends, fortunately or unfortunately, there's no permanent solution of polycystic ovaries because something which is in our genes that cannot vanish completely by anything and everything that we do. So it is important that polycystic ovaries do not show its symptoms or signs. And what are those symptoms? Irregular periods and excess of male hormone. So it is very important to keep our weight under control, exercise, and follow a very healthy lifestyle so that polycystic ovaries remains, but the symptoms that they cause, known as PCOS or PCOD, do not continue further. Sometimes we give you a low dose oral contraceptive pills which make you bleed, because there are many women or many girls who come to the clinic and say that they have not bled for almost 3 months. In such a scenario, to regularize periods, we sometimes give oral contraceptive pills, but at the same time, it is very important to understand that the effect of these oral contraceptive pills is very, very short-lived. It stays only for the time we are taking the pill. The moment we stop the pill, the polycystic ovarian syndrome again comes up. So the permanent solution is exercise, and a healthy lifestyle and healthy sleep. Sometimes people come to us with a problem of not conceiving. So most of us fear if we have polycystic ovaries, then conception will be a problem. Yes, conception can be a problem in some cases because of prolonged cycles. We do not understand when we are ovulating, and that's why we do not understand when should we be together with our partner. So that's the reason where problems occur in case of polycystic ovaries. Next slide, please. Fibroids. So fibroids are benign smooth muscle tumors of the uterus. These are in common Hindi language called rasodi. This happens due to excess estrogen content inside a woman's body. roughly the incidence is 20 to 40%. The fibroids can be classified as intramural, situated inside the wall of the uterus, submucosal inside the endometrial lining of the uterus, or sitting on the neck ear of the uterus, called subserosal. Now, most common symptoms of fibroid is excessive bleeding. Some may have pressure symptoms, and some may also lead to infertility. So whenever you have a fibroid, it is important to get it investigated by doing an ultrasound. Not all fibroids need to be removed because it is as common as 20 to 40%. If it is causing some problems, then first treatment is by pills, medical management. If it is not resolving by giving pills, then we resort to any kind of surgery. Next slide, please. So in this slide, this depicts fibroids. The one sitting inside the wall of the uterus is known as intramural fibroid. The one inside the cavity of the uterus is known as submucosal fibroid. Next slide, please. Endometriosis, again, a very, very common disorder, approximately affecting 10 to 15% of the girls visiting a gynae clinic. Now, whenever we bleed, whenever we have our periods, most of the blood has to flow out. Rather, all the blood has to flow out. Now, sometimes in cases of endometriosis, there is backflow of blood into the tubes and the ovary. Whenever this happens, the tube and the ovary are scarred, and the old blood is collected in form of a cyst called endometrioma. So I explain again. So the endometrial tissue, or the lining of the uterus, is a very unique tissue to be found only inside the uterus. And it has to bleed every month during our periods, and 100% of the blood is supposed to come out. In some cases, there is backflow of this blood, and whenever backflow happens, it leads to a condition called endometriosis. Now, the symptoms are excessive, extreme pain when you have your periods, excessive pain during intercourse, excessive pain at the time you're with your partner, which is called dysmenorrhea. Some women also face extreme pain while passing stools during the time of menses. Endometriosis can also lead to infertility or subfertility. And it is very, very important to diagnose endometriosis, because sometimes the life of the girl or the lady can be crippled. Treatment is very simple. We have to stop periods for some time. So we give oral contraceptive pills sometimes. Sometimes certain hormonal therapy is given to give you relief from endometriosis. Next slide, please. Now, again, a very, very common problem. Most of us fear this problem, which is known as PID. It is a simple infection of our pelvic organs. So generally, any STD causing bacteria, any sexually transmitted disease causing bacteria enters through the cervix, passes through the uterine cavity, goes to the fallopian tube, and finally aggravates in the fallopian tube and near the ovaries, and eventually spreads through all the organs of our pelvic area. So the three common conditions medically are called salpingitis, oophorytis, or tubo-ovarian abscess. Next slide, please. Now, whenever any person has PID, it is important to fully treat that infection, because if that infection stays inside our body, it can lead to scarring of our reproductive organs and thus cause infertility. So coming on to infertility, infertility is unfortunately becoming a new epidemic of this century. So you'll be surprised to know that 1 out of every 6 couples in rural area face difficulties in conception. In urban area, this difficulty rate is much, much higher. It is 1 in every 4 couples. So it's important to understand what this problem is exactly. So if a couple is together without using any contraception, having regular intercourse, but unable to conceive a child, is called to be suffering from infertility. Now, infertility is not a female problem. 1/3 of the cases are contributed by males, 1/3 by females, and the rest 1/3 are combination of both the partners. So sending the female alone to the fertility clinic, blaming the female alone is not right. It's a couple problem, and both the partners need to be treated together. Next slide, please. So the major causes of infertility in case of a female can be problems with ovulation, which can be due to polycystic ovaries, endometriosis, or some hormonal imbalance in the woman's body. It can be due to blocked fallopian tubes. Suppose a girl is suffering from PID, tuberculosis, then the tubes, which I told are very, very sensitive, are the first organs to get disturbed and blocked. Sometimes the causes of infertility can be due to problems in a female uterus, like polyps, fibroid. Sometimes it might be due to certain antibodies inside the cervix of the female vagina, which inhibits sperms to come inside. So any of these 4 or 5 conditions can lead to female infertility. Some female also threat or also have a mental block in having intercourse, which is known as vaginismus. So all these conditions can lead to female infertility. Next slide, please. Now, if we talk about male fertility, whenever a couple comes to our clinic, we first perform a semen analysis on the male. We check the count, we check the motility, and we check the morphology, which means the shape of the sperms. Now, any problem in count, motility, or morphology can lead to male infertility, which can be cured sometimes with very simple medications. Sometimes, due to the stress of present era, due to the stress of work, due to our lifestyle, too much of alcohol, too much of smoking, we have seen that almost 50% men have difficulty in intercourse. They have problems like erectile dysfunction or ejaculatory disorders. Now, unfortunately, these are majority lifestyle problems. We have seen that by simple talking, by simple mental relaxation techniques, most of the men suffering from ED or ejaculatory problems become absolutely normal. So if we have to enumerate the causes of male fertility, it includes varicocele, infection, any tumors in the reproductive tract, ejaculation problems, problems with erectile dysfunction, premature ejaculation, and anatomical problems. Next slide, please. Now, does infertility always means IUI or IVF? No, not at all. So whenever a couple comes to us, we first try to resolve problem by giving simple medications to the couple. Sometimes certain hormonal therapy. Majority, we explain the art of healthy lifestyle, having a balanced diet, good night's sleep, and keeping hydration solves problem for most of the couples. The remaining 10 to 15%, we try to help them conceive by simple assisted reproductive techniques like IUI or IVF. Next slide, please. So just to make you understand what are the treatment options for any infertile couple, as we discussed, simple medicines, simple lifestyle changes. Sometimes we do an IUI for the female. in which the moment she is ovulating, we take the partner's semen sample, wash that sample in the laboratory, and push that prepared sample inside the uterus of the lady. Then sometimes we do an IVF cycle, especially when the fallopian tubes of the woman are blocked, or when the male semen parameters are severely abnormal. Then we advise an IVF cycle. Then sometimes different techniques like surrogacy or donor eggs or donor sperms are advised in very, very specific scenarios. So as we discussed, this diagram depicts IUI. So first we track ovulation by doing serial ultrasound monitoring of the lady. And when we see that she is ovulating, we take the partner's semen sample, wash that sample, that is, remove all the impurities, dead sperms, and pus cells from the semen sample. And with a very, very tiny tube as shown in the figure, we squirt the sample inside the uterus of the lady. Next slide, please. Now, this picture depicts IVF or test tube baby or in vitro fertilization. IVF involves or starts with ovarian stimulation. Normally, we are forming only one egg in our ovary. In case of IVF, we give certain hormonal injections which help both the ovaries form multiple eggs, of course, in safe limits. Now, when all these eggs are mature, we insert a very, very tiny, very, very thin needle through the vagina, go to the ovary, retrieve eggs from both the ovaries. After we've retrieved eggs, we take the partner's semen sample, separate the best quality sperms from the sample, combine the egg with the sperm to form an embryo, and then we take and grow this embryo inside the IVF lab for 5 days. And then finally, this prepared embryo is injected inside the womb of the lady, again by a very, very thin cannula. Next slide, please. Now, egg freezing is a boon. It is a great advancement done in medical science today. So egg freezing started with people who were unfortunately suffering from cancer. Any sort of chemotherapeutic drugs can cause these eggs to deteriorate in quality and quantity. That's why any person who was supposed to take chemotherapy in future was advised egg freezing so that she can preserve good quality eggs for future use. But now social egg freezing, as in case if a girl decides to postpone her pregnancy because she's not found the right partner, she's very busy in her studies, in her academics, can opt for egg freezing and use these eggs later on for a period of 10 years. Now, egg freezing is done in minus 196-degree temperature in liquid nitrogen, and the rules of our country allow eggs to be frozen for a period of 10 years. It's a very, very safe process, and it helps us to lock our biological age, because as we age, the quality of the eggs that we have in our ovaries continuously decline, and with declining quality, the chances of achieving a pregnancy deteriorates, the chances of miscarriage or abnormal baby continuously rise. Next slide, please. So, last but not the least, what is good feminine hygiene? So, it's important to avoid perfumes, deodorants, and powders in the vagina. The majority of odor which comes from a female is not due to vagina, but due to the inner thigh, sweat in the inner thighs and folds. So to prevent that, it is important to maintain a healthy weight, especially in the inner thighs, exercise routinely, follow a healthy and disciplined lifestyle. It is always advisable to wear comfortable innerwears, especially cotton innerwears. During the menstrual time, instead of using synthetic pads, it's always a better option to use menstrual cup or tampons. And in the end, it is very important to follow your heart, live a healthy lifestyle, do your work properly, and when you get time, enjoy. Next slide, please. So just to summarize, be physically active, 7 to 8 hours of sleep should be our top priority. Annual well-woman examination where all the tests are conducted should be scheduled. Quit smoking for good, improve your diet, have a balanced, healthy lifestyle. And it is always important to escape monotony of your daily routine. So take break from work at regular intervals. Next slide. So also, sometimes we do not remind ourselves that family is our priority. And if we are physically healthy and mentally sound, only then we'll be able to spend time with our family. It is important to eat healthy, exercise routinely. Do not get stressed if you look slightly overweight. Work on it. Identify your problems and then find solutions. And whenever in doubt, please do not hesitate in consulting a specialist. So I would be very happy to answer all your queries.
Dr. Prachi, so we have one question. So like the question is, what is the relationship between menopause and osteoporosis? Is calcium only indicator of bone health?
Okay, so it's a very important question. So majority of us who are into premenopausal or menopausal age group should be aware of bone health. The bones need a hormone called estrogen for their healthy being. But whenever we attain menopause, the level of estrogen hormone goes down. And that's the reason why calcium is not absorbed properly inside the bones and they lead to osteoporosis and early fractures. So perimenopausal time and menopausal time, it is very important to maintain a good calcium intake. Again, it is important to consult your physician because too much of calcium can sometimes lead to stones, renal kidney stones. So everything should be in moderation. But yes, the bone health deteriorates after menopause and it is important to take calcium supplements. I hope that answers your question. What is the earliest time for congenital anomalies to occur? Okay, so if you are asking me what is the earliest time when we can diagnose congenital anomalies, it is at 3 months of conception in the level 1 scan. And if you're asking me when do they occur, they generally occur in the initial 3 months of pregnancy because that's the time when most of the organs of the baby are forming. So any and every pregnancy at 3 months is screened in detail of any congenital anomalies. Post-marriage, it's been 6 months. The menstrual cycle has changed from 27 to 30 and this month 33 days. Is it a matter of concern? Okay, so there is a question which says that earlier this lady used to get periods every 27 days. That gradually changed to 30 and now to 33 days. Now, it is very important to understand that prolonged periods can delay the time of ovulation. So actually, prolonged periods happen due to delayed ovulation. So if you think that the delay is continuously happening, please get yourself ultrasound done. And also, please keep your daily routine under a check because this generally happens in case you gain weight. So the male hormones come into our body when we gain weight, especially in the fat tissues that we have. And that's the main reason of prolonging our cycles. So an ultrasound and check on weight is required. What is the general menopausal age currently? Unfortunately, a very disturbing phenomenon we see these days, which is known as premature menopause or early menopause. which comes even at the age of 36 to 40 years of age. The routine age is, of course, 45 to 50 years, but seeing premature menopause is not very uncommon. What is the success rate of IVF on the first try? So IVF success rate is dependent on the age of the couple, on the ovarian reserve of the lady, and the cause why they are doing IVF. So best of circumstances, the IVF success rate can even be up to 75 to 80%. But this success rate continuously declines with increasing age. So thank you very much. In case there are any other queries which are coming to your mind, feel very free to contact us anytime. Thank you.